Hello everyone and welcome. In this video we're gonna discuss some important aspects of person-centered care processes. The first thing that pops up in our mind upon looking at this sentence is what is exactly person-centered care and how and why it's relevant and important in nursing profession. Well, there are multiple definitions for person-centered care which basically refers to the same meaning. However, for the purpose of our video, upon looking at one particular definition about person-centered care, according to Health Innovation Network, South London, person-centered care is a way of thinking and doing things that sees the people using health and services as equal partners in planning, developing and monitoring care to make sure it meets their needs. For example, it means putting people, their families, their relatives at the center of decision making and seeing themselves as experts working alongside with professionals to get the best possible solutions and outcomes for their problems. It's not about taking care of people's demands or providing them information about certain things. Instead, it's about taking care of people's desires, values, family systems, seeing themselves as an individual and working together to develop appropriate solutions for their problems. Now, moving on to the person-centered care processes. This is the person-centered care framework which represents various parts. The outer part represents the prerequisites or the attributes of nurses. This includes factors such as clarity of beliefs, commitment to the job, and being aware of our own self or knowing self. Similarly, the second part of the framework represents the care environment or context in which care is delivered. This includes factors such as appropriate skill use, shared decision making, and providing safe and appropriate care environment. Now, moving on to the person-centered care processes. This is person-centered care framework which represents various processes. The first one is working with patients' beliefs and values, which refers to having a clear picture of what values patient is having about his or her life, engaging authentically or engaging genuinely. Shared decision making, which refers to involvement of patients, family members, and relatives in the decision making process. Being sympathetically present, which refers to acting with support, trust, and sharing in others' emotions. Providing holistic care, which is basically focused on person's physiological, psychological, socio-cultural, developmental, and spiritual dimensions. The central part of the framework represents outcomes or results which are to be expected if proper person-centered care processes are followed. In this video, we're going to explain each of these processes thoroughly. So, grab a seat and have a cup of coffee. Being sympathetically present. According to Snellman, in person-centered care, being sympathetically present refers to acting with support, trust, and sharing emotions with the patient who is going through some difficult situations. Essential values required to achieve person-centered care includes devotion, generosity, sensibility, softness, and empathy. Similarly, according to Norton, patients feels that maintaining healthy relationship with nurses is very important as it enables them to be treated with full compassion, respect, and sympathy. The following video represents a great example of sympathetic presence. So, grab some popcorns meanwhile I play the video.
Good thing the water cooler is close by. Did you want it or do you want me to just put it up here?
Yeah, just put it up for sure.
You okay?
No,
What's wrong?
I'm very, very upset today.
What happened?
My granddaughter is getting married tomorrow.
That's exciting.
But I won't be able to attend look at her.
Right.
You know, I'm in hospital.
Oh my goodness.
I brought her up. She's my only granddaughter.
You must be feeling so horrible.
I'm feeling so bad.
Oh, here, darling. Do you want a tissue, darling? Man, you must feel so bad. Like, you brought her up and you're going to miss the wedding, all the photos that she'll be in, and you know when they sit the group together and take a family photo, you won't be in that.
No, I won't be able to.
Man, that would suck so bad. Oh, I'm so sorry for you.
I'm feeling so bad. Oh, my only granddaughter.
Working with patients' beliefs and values. It basically refers to having a clear understanding of what patient values about their life and how they make sense of what is happening from their psychological context, social role, and their individual perspectives. Working with patients' beliefs and values is basic principle of person-centered nursing, which is focused on identifying patients' values and then providing care while taking in care of those values. According to a study, patients like being involved in decision making. Moreover, it also showed that patients have specific values for a given decision, which cannot be pre-assumed by anyone in the healthcare environment. It is achieved by planning care for a patient by integrating things which they consider important in order to maintain their beliefs, values, and expressions. Shared decision making. It is a consultation process for making important health decisions such as treatment options, benefits, and harms, which basically involves a health practitioner and patient and their families. Important consideration for patient involves values, beliefs, preferences, and circumstances. Shared decision making is a critical marker for good clinical practice to promote patient-centered care through enhancement of patients' involvement in their treatments, and this significantly increases their self-worth. In shared decision making, the patient is given a part to play in helping practitioner to discover new ways of working, and a real partnership is established between them. In the following scenario, Gina is a 24-year-old teacher. She is a healthy and highly intelligent girl. She is living with her mother and 2 siblings. She is happy and satisfied with her job. For several months, she has been planning for a short vacation and was able to save money for it in her joint bank account that she shared with her mother. One morning, while having her usual breakfast with her family, she mentioned her plan to have a short vacation and asked her mother to draw some money from their bank account for her travel expenses. However, her mother told her that there is not enough money left on their bank account as she used most of the money to open new food business and thought traveling is not a wise idea and waste of money rather. Gina got surprised and disappointed by her mother's decision. This scenario represents a situation which poses a great challenge to the shared decision-making process, as Gina's mother made some important decisions on her own without involving her daughter, who was perhaps directly linked and got affected by the decision. Providing holistic care. It refers to the provision of treatment and care that pays attention to the whole person through integration of physiological, psychological, socio-cultural, developmental, and spiritual dimensions. The physiological variable refers to the bodily structure and functions. The psychological variable refers to the mental processes and relationships. The socio-cultural variable refers to the social and cultural influences. The developmental variable refers to the developmental processes of life. The spiritual variable refers to the influence of spiritual beliefs. 5 core values that capture a sense of holistic nursing includes holistic philosophy, holistic caring processes, holistic communication, holistic education and research, and holistic self-care. Providing holistic care is about educating patients about self-care and helping them to perform their activities independently. This increases self-awareness and self-confidence in patients, and this also allows nurses to better understand the effects of an illness on a person's entire life and their true needs. Engaging authentically. It refers to the connectedness of the practitioner with the patient, which leads to positive outcomes. The ability to engage and connect with the patient is strongly dependent on practitioner's abilities, knowledge of the person, clarity of beliefs and values, and knowledge of self. Following the person-centered care processes appropriately and efficiently leads to the central part of the framework, the outcomes. These outcomes comprises of good care experience, which is defined as a total of positive interactions formed by the culture of an organization, which impacts patients' viewpoint throughout the care process, leading to an anticipated health outcome. Similarly, focusing on patients' experience during healthcare brings a competitive advantage to an organization. Good care experience comprises of patients' satisfaction with the care delivery, patients being happy, mentally and emotionally strong, an overall improvement in patients' health, dignity, kindness, and respect, so that the patients feel that staff support and care about them. The second outcome is involvement of care. This is referred to as involvement of patient in decision making or expressing opinions about different treatment methods, which includes sharing information, feelings, signs, and accepting health team instructions. Factors influencing patient participation includes doctor-patient relationship, recognition of patient's knowledge, and allocation of sufficient time to the patient for participation process. Similarly, factors related to patient includes knowledge, physical and cognitive ability, emotional connections, and values and beliefs. Number 3 outcome is feeling of well-being, which is a positive state which involves feeling good and functioning well. Positive care experiences creates a positive feeling of well-being among patients. It also makes them feel valued. Just an example, a patient is feeling very depressed because of any reason, and a nurse approaches the patient and gives him some empathy, and the patient starts to feel very good after being listened empathetically. Existence of a healthful culture is the ultimate outcome for teams working together to develop a workplace that is person-centered. It emphasizes over maintaining a nursing care environment which supports and keeps up the person-centered values. It is underpinned by values of respect for persons, individuals' right to self-determination, and mutual respect and understanding. The outcomes identified within the framework provide a clear focus for evaluation of person-centered processes. The last part of the video is some leadership challenges to the person-centered processes. Number 1 is lack of self-awareness. This means lack of reflection about different cultural values and beliefs, and perhaps this may impact the treatment of a culturally diverse patient. Number 2 is inability to balance between outer pressures. This includes political, environmental, and social challenges. Number 3 is lack of cooperation, which means lack of mutuality and understanding between patient and the practitioner, or between doctor and the nurse. Number 4 is lack of self-awareness. This includes lack of emotional attachment and lack of understanding of feelings, and hence this directly affects the sympathetic approach. So, in conclusion, person-centered care processes are a vital part of providing person-centered care. However, it's really important to cope up with the challenges posed to person-centered care, as they greatly impact the health care of a country. Following the person-centered care framework while delivering the care leads to the outcomes which improves the standard of healthcare of a country. So, moving on to the end of this video, we got 2 clips which represents poor and good person-centered care respectively. We hope you enjoy this video and get the best out of this lesson. Thank you.
Mr. T, it's time for your bath. Let's get you up and moving so we don't have to wait in line at the showers.
What? Who are you? And where's Nancy? Why, it's not time for my bath yet. I get it later in the day so I can go sit in the great room and watch the nest in the magnolia tree. The eggs are just about ready to hatch. I just want to go to the great room.
Well, Nancy's out sick today, and I have to do this whole floor all by myself, so we don't have time to wait. If you're getting a shower today, we need to do it now.
I don't want my shower now. I just want to go to the great room.
Come on, Mr. T. Get in the wheelchair. What's the matter with your shoulder?
Never mind. I'll get myself to the great room.
Okay, fine.
Come in.
Good morning, Mr. Tarkey. My name is April. May I turn on the light?
Why, sure.
Nancy's out sick today, so I'll be helping residents on this floor this morning. I understand you like to get up early and go watch the birds out in the great room. But since the weather's supposed to be bad for a few hours, I wondered if you'd like to take your shower now so you don't have to be interrupted later.
That's a great idea. And I do shower pretty fast.
I understand you hurt your shoulder. How's that feeling this morning?
Well, it's a little worse today. But I might need a little bit of help getting into the wheelchair.
Sure thing, and I'll let the DON know that your shoulder's hurting worse today.
I can't find that out. There we are.